Hey all, welcome back to the Real Life Pharmacology podcast. I'm your host, pharmacist Eric Christensen. Today's episode is sponsored by meded101.com. Go check out their resources for nurses, pharmacists, med students, anyone needing some pharmacology education. We've got a growing list of resources there. All the links to books, study materials, you can find at meded101.com/store. So go check that out and support the sponsor. All right, so let's get back to the podcast, and we are covering drugs 6 through 10 in the top 200 drugs. I'm going to give an outline, brief points that are commonly tested on in pharmacology and board exams throughout your career. So hopefully this is a good overview for you. All right, the number 6 medication is amoxicillin. Most common brand name I've seen in practice is Amoxil. This is an antibiotic for infection. It is classified as a penicillin type antibiotic, and you're going to see this most often used for upper respiratory tract infections, ear infections. Occasionally you may see it for skin infections as well. Strep throat comes to mind. That's been something that's been going around recently in the last several months. So those are common indications that amoxicillin is used for. From an adverse effect profile, the number one thing to remember here is diarrhea. It's the most often, the highest, most frequently complained about adverse effect that I've seen in practice for sure. GI upset, some nausea, that type of thing, that can correlate with that as well. And then, of course, we've got rash. So, again, probably less common than diarrhea, but definitely something to be aware of there. Also, pay attention to those allergies. I see numerous patients with recorded penicillin, amoxicillin type allergies. Certainly, we can have some reactivity there if we re-challenge in some situations. In other situations, we may be able to actually re-challenge, but again, it depends upon some good history taking and possibly some allergy testing there as well too. So definitely can be a challenge. We want to use all the medications and have all the tools that we possibly can, but sometimes we can't if that allergic reaction was severe with the use of amoxicillin. All right, the next medication is another antibiotic for infection, and this is azithromycin. Brand name is Zithromax, and this is a macrolide antibiotic. We also have other macrolides, erythromycin, clarithromycin. Definitely one claim to fame with azithromycin is it generally tends to have less drug interactions. We don't have to worry as much about like CYP3A4 interactions compared to other macrolide antibiotics. It's used primarily for upper respiratory tract infections as an alternative to penicillin type antibiotics. So if somebody has a significant penicillin, amoxicillin allergy, Zithromax or azithromycin would be a potential alternative here. I should mention both amoxicillin and azithromycin are frequently used in pediatrics. So that is probably one of the most common situations where I see those medications utilized. Adverse effect profile, GI is probably going to be the most common. There are some rare hepatic issues that can happen. And then we've got QTc prolongation as well. From a kinetic standpoint, comparing it, I guess, to amoxicillin, since we've been discussing that medication here as well. It's got a longer half-life, as azithromycin does, and so we can get by with a little bit more convenient dosing. Typically once a day dosing is allowable with azithromycin. So if that patient adherence is a concern with, 2 a day or a 3 day type of drug, azithromycin may be beneficial there. Drug interactions with azithromycin, I did want to mention that QTc prolongation risk. So if you've got a patient on antiarrhythmics, like amiodarone, for example, maybe they're on antipsychotics, which has some QT prolonging activity. SSRI like citalopram. These can all have additive effects potentially on top of adding that azithromycin. All right, number 8 and the third drug today is hydrochlorothiazide. Brand name of this medication is microzide. Aquazide is another name I've heard thrown around as well. Also, the abbreviation HCTZ is commonly used in practice as well. Not something I recommend doing because I've seen mix-ups with HCT, hydrocortisone, and hydrochlorothiazide, HCTZ. So again, you got to be really, really careful with some of those abbreviations. They can be interpreted as different things there. All right, so obviously this is a blood pressure medication. Occasionally I see it for some fluid loss, for managing edema type symptoms as well. But again, by and large, you're going to see this one used for hypertension. Often it comes in a ton of combinations. So combined with ACE inhibitors and kind of those dual pill formulations where a patient can get 2 medications in one pill, that can certainly be advantageous for adherence. Adverse effects, we've got frequent urination. That is definitely a problem. I see patients report that all the time. So pay attention to that. Generally, don't dose it too late in the day, then people will be up peeing all night. Hypokalemia, so it kicks out potassium with the fluid and the diuretic effect there. So make sure we're monitoring that. Can lead to some dehydration, so renal function monitoring is important there. And then gout I wanted to mention too. So it can increase uric acid and may exacerbate gout. From a drug interaction standpoint, lithium's always one that comes to mind. With hydrochlorothiazide, it can increase lithium concentrations and increase the risk for toxicity there. And then it can counteract some of those gout medications that, like allopurinol, for example, where we may be trying to reduce uric acid. Hydrochlorothiazide may counteract that and actually increase uric acid. Number 9 is amlodipine. Brand name of this medication is Norvasc. This is a calcium channel blocker, a dihydropyridine. Primary use is going to be hypertension. It can certainly play a role in angina as well. Rare disease state like Raynaud's disorder as well. Adverse effect profile, edema. Edema is definitely the number one adverse effect that you want to be aware of. Also can cause some constipation. So this is definitely a medication that I certainly have seen lead to the prescribing cascade where a patient reports some edema and now a provider is adding loop diuretic, for example, to try to get rid of that edema. Or constipation, same thing. We're adding some more medications there, but by and large, that edema adverse effect with calcium channel blockers like amlodipine is really, really important. There are a few interactions with amlodipine. We've got some, CYP-mediated interactions. It can increase simvastatin concentrations. So that's important to recognize if a patient's reporting an increase in, myopathy, muscle pain, that type of thing. Adding amlodipine on board to a patient already taking simvastatin could increase those concentrations and increase the risk for toxicity. All right, our last medication, number 10, is Alprazolam. Brand name of this medication is Xanax. This is a benzodiazepine used for anxiety. And again, this is more so for the acute relief of anxiety. We really want to try to avoid using benzodiazepines on a chronic basis. They are a controlled substance. We've got the risk of addiction and dependence. In our geriatric patient population, the adverse effect profile can definitely be problematic. So got to be super, super careful with driving, operating machinery, sedation, falls, confusion. These are all potential adverse effects with the use of Alprazolam. One drug interaction I wanted to mention, there is a boxed warning with regard to the use of opioids in combination with benzodiazepines like Alprazolam. So this can definitely increase the risk for respiratory depression, excessive sedation, and so on and so forth. All right. Well, I think that's going to wrap up the podcast for today. If you want the top 200 drugs study guide, go to reallifepharmacology.com. You can get that absolutely for free. Simply an email is all it's going to take. So go take advantage of that. Sign up. We also get you emails when we've got new podcasts available and other content as well. So definitely don't hesitate to do that. I try to respond to all the emails I get, mededucation101@gmail.com. So if you got comments, suggestions, different ideas for the podcast, I'm certainly open to that and do the best I can to try to accommodate folks. So don't hesitate to do that. Again, mededucation101@gmail.com. If you want to connect with me on LinkedIn, I do plenty of consulting, speaking, and other things as well. Eric Christensen, PharmD, BCPS, BCGP. So go check me out there as well. And of course, support the sponsor. If you're looking for pharmacist board certification study materials, BCPS, ambulatory care, BCM, TMS, NAPLEX, and so on. Lots of great resources there have helped thousands of pharmacists pass their board exams. So definitely go check that out as well. Thank you guys so much for listening. Take care, and I hope you have a great rest of your day.